Hi, Mr. Thomas. How are you?
Hi.
My name is Dr. Nash. I'm the nurse practitioner who's going to be taking care of you today.
Good, doctor.
So I talked to my assistant, Missy, and she said you're having quite a bit of dental pain today. Can
Right.
you tell me a little bit about that?
Yeah, I got very few good teeth left. But about 3 or 4 days ago, I guess it was, I started getting pain over here, like lower jaw.
Okay.
And then I've had a throbbing and a hurt down here in my neck, too, right near the same side.
Okay.
And that's kind of recent.
Okay. Well, sometimes we use a scale to kind of get a better idea of where your pain is, and thinking of 1 being the least amount of pain and 10
Okay.
being the absolute worst. Where would you say your pain is right now?
I'd say right now it's about a 7, but as soon as I start chewing anything, it becomes like a 10.
Okay. Well, that sounds uncomfortable.
Yeah.
What have you tried at home to make it a bit better?
You know, the only thing I tried some Tylenol, and that didn't do any good. And then I tried some pills that my wife had around from her hip replacement, and that just kind of made me dizzy and sick. So
Okay.
that didn't do any good.
Okay.
And I don't know, the pain didn't seem to go away.
Okay. And so using your wife's medication, I guess, I know it's expensive to get to go see somebody. So,
Right.
so as far as your insurance, do you have your Medicare now and Medicaid, or have you?
We've got Medicare, and we do not have dental insurance. That's
Okay.
one reason I'm concerned about this and would like the medicine or whatever we have to do to make the pain go away.
Certainly, yes. Dental care can be quite costly. Absolutely. Well, I'm hoping that together we can come up with a plan that might work. What I'd like to do is just ask you some general questions and get a better idea of kind of where you are
Sure.
with your health. And I noticed this is the first time you've seen us.
Right.
Do you have another provider that you've seen?
No, I really don't, Doc. I went to one of those urgent care places
Sure.
back some time ago, and I'd cut my finger on a glass. And it took a while for the pain to go away, but you know, I got better, and I'm generally pretty healthy. So I haven't needed to do that now. You know, I've had some problem. A few years ago, somebody said doctor told me I had diabetes, and so I started taking some medication for that. But
Okay.
I felt better, so I didn't think I needed to keep taking it.
Okay. And when you had this cut, did it take a while for it to heal?
Yeah, it did.
It did. Okay.
Right.
Okay. And so you haven't been on that medicine for a while.
No.
Okay. Any problems with chest pain, shortness of breath, anything like that?
No, I can walk around the farm pretty good just about every day without running out of breath.
Okay, well that's great. What about polyuria or nocturia?
I assume that has something to do with urination.
Yes.
Okay, I know as you get older, you pee more, and so I've had that.
Okay.
But I don't think it's been anything, it hadn't bothered me
Okay.
a whole lot.
Well, I have a little concern that maybe your diabetes may have progressed a little bit. It's generally not something that typically goes away.
Really?
And then certainly with a little bit of the uncontrolled diabetes, your body's ability to heal, like for example with your finger that you had cut, and then maybe possibly even with this infection that sounds like you have in your tooth, we just want to look at the whole picture.
Gotcha, okay.
So I think we can come up with a plan to address most of these issues. I have a wonderful woman that we work with, Ms. Hughes, who can help us maybe investigate where we could get you into a clinic that would work with your financial constraints. And I'd like to give her a call if that would be okay with you.
Sure.
Okay, great. And while you're here, since we have you in the office today, I'd like to get some basic blood work.
Okay.
Just to get a full picture of what's going on, check your diabetes and that kind of thing. But we're going to go ahead and get you on an antibiotic because I know you're uncomfortable,
Right.
and get you something for the inflammation
Right.
to go ahead and get that started. And Missy, who you met, is going to give you a rinse to kind of help ease the pain and reduce the bacteria that's there.
Okay.
But I'm hoping to get you in the dental clinic today or tomorrow.
Okay.
And we'll get the blood work today, but I'd like to have you follow up just as soon as you get done at the dental clinic, either the next day or the day after that, so we can kind of talk about the blood work that we're doing today and come up with a way to address some of those concerns as well. Does that sound reasonable?
Yeah, anything that would make the pain go away and help my teeth.
Absolutely. Well, let's get that blood work done, and I'll put the call into Miss Hughes.
Okay, very
All
good.
right.
Thanks, Doc.
Thank you. It's nice to meet you.
Nice meeting you.
let's talk about this a little bit.
Okay.
When I looked in your mouth, I can see that the tissue down there on the lower right, where you were telling me that it was so uncomfortable,
Right.
it's really swollen, it's inflamed, and when I took that instrument and felt around the teeth, it bled real easily, and there was also some infection that was obvious there. There's some pus in that area whenever I was feeling around the tooth. And I can feel some hard stuff underneath your gums. So I can see plaque, and I can see tartar or calculus, and I can see the infection that's there because there's pus, and it just looks like it must be real uncomfortable for you.
It is. Yeah, does it sound like I have an abscessed tooth and I might have to have a root canal? Because what I'd rather do is just pull the damn tooth and get it over with.
Well, there's two different kinds of abscesses, and the kind of abscess that you have is not the kind of abscess that can be fixed with a root canal, but it's actually easier to fix because it's a gum abscess instead of being a tooth abscess.
Okay.
So no, I don't think you're going to have a tooth taken out today, but we do need to do some work on it.
Yeah.
And I wanted to talk a little bit about, you told me that you were mentioning the fact that you'd had been diagnosed with diabetes before. Can you tell me a little bit about that?
Yeah, some time ago they said that I had diabetes and they gave me some kind of medication for it, and they said to kind of watch the level, and my wife helped with that a little bit, and it became like normal, and so after my pills were out, I just didn't go back and get them refilled because I didn't think I needed them anymore. So I thought the diabetes was pretty well gone away.
Okay. Well, diabetes usually doesn't work that way. And so that's one of the reasons why your nurse practitioner was so concerned and sent you to see us, is because sometimes abscesses like this in the mouth are related to diabetes that's not well controlled.
Oh, really?
Sure enough.
Okay.
And I don't want you to have any more trouble with any of these abscesses, so what we need to do today is we need to take care of this abscess now. We need to be sure that we check your mouth so we can see whether or not there are any other spots that you might develop these abscesses and get you healthy in your mouth.
This nurse practitioner had said she was concerned about the diabetes too. And I thought she was kind of imagining that, so I didn't pay much attention to you just said what you said. So I probably screwed up when I stopped taking the diabetes medication just based on what she said and what you said.
Well, it's real important for you to be sure that you go back to see the nurse practitioner, and let's be sure we get the diabetes back under control again. She's going to be real interested in some of the numbers that she's going to have. I'm guessing she did some blood work for you,
yeah.
So she's going to be able to see how controlled you are. And I'm guessing that she may put you back on some kind of medication. And if she puts you back on some kind of medication, you really do need to continue taking that medication until they tell you not to, or if they change it. But you need to follow through with it, because diabetes just doesn't go away. It's something that you can control, but we can't cure yet.
Yeah,
so you got to continue to treat it, even, and it's hard to do, I know, but it's one of those things. It's worth it, because one of the things that can happen is that you can have a situation like you do in your mouth right now, just like there can be problems with your eyes or your heart or your kidneys or your feet with diabetes. You can also have these abscesses develop in your mouth. The bone around your teeth that holds them in place, you've lost a little bit of that in this area where we've been looking, and we need to be able to try to fix that. And what we need to do today is get in there and get you really good and numb so you don't feel anything. And then I'm going to go in and clean out all that stuff around there. And I know that you're taking some antibiotics, so I want you to keep taking the antibiotics and take all of them that she gave you, and keep using the mouth rinse that she gave you. And then we'll see you back here in a week and make sure that's all worked out and everything's clearing up.
The stuff you're talking about doing, am I going to have shots? I hate shots.
Yeah, I need to get you numb so you don't feel anything, because it'll make it easier for you and for me both for you to have the treatment done. I'm going to use instruments that will make it very uncomfortable if you can feel it.
Okay, so it's going to be better for both of us?
It sure will. It'll be better for you and it'll be better for me. You'll feel better because you won't feel what I'm doing, and I'll do better work because I know I'm not hurting you.
Okay. But will I have to come back?
Yes, I really need for you to come back, because I need to be sure that what we did actually solved your problem. The other thing we need to do is check around all your other teeth and make sure that everything else is okay. Remove any of the stuff that causes abscesses like that. And I'm hoping that we'll be able to fix it in such a way that you won't have any more abscesses. Then we'll keep you on a regular recall so we get in there and clean it out when it's easy, not when it's hard like it is right now.
Doc, I hate coming to the dentist.
I know, but it gets easier with time, and it's kind of like taking your diabetes medicine every day. Taking your diabetes medicine every day keeps your diabetes under control. Coming to the dentist on a regular basis helps keep the problems in your mouth under control.
Okay, well, let's get on with it. I just want to get over the damn pain. I'm tired of hurting all the time, so let's do what we got to do.
Okay, I understand.
I certainly have some concerns and want to learn more about him. He has a lot of barriers to his care. We're concerned about the dental pain, certainly, but some of his lab values came back abnormal, and we're really interested in trying to develop some kind of a plan for him. Really glad you could get him into the dental clinic, so anxious to hear more about what's going on.
Yeah, you're right. It's a very complicated situation. They live in a old farmhouse. It's neat, it's tidy. However, there are some improvements that they need to make, but they really just can't afford it anymore.
And you keep saying they, and I guess you're talking about his wife. I know she recently had a hip replacement. Is there anyone else that lives with them?
So yes, it is Mr. Thomas and his wife, but they also have their granddaughter who they've raised. Their son passed away when I think he was in his 30s or 40s, but he left behind a 5-year-old daughter, and they've raised her, and now she's in her early 30s. But my understanding is that she works at a local nursing home, and on her off days, she really spends time at her boyfriend's house and lives there with him. But she also has a very young son, and so Mr. Thomas and his wife are helping to take care of the young son, so it's their great-grandson. They also are having a lot of trouble in terms of some of their health problems. So Miss Thomas, like you said, recently had hip surgery. She has a hard time moving around, not very mobile. She's also obese, and she has arthritis problems as a result of that. So really they're struggling right now with a lot of things. And it sounds like that the granddaughter helps out when she can, but her income's also very limited.
Now, does Ms. Thomas, does she have a primary care provider? Is there someone that's coordinating her care?
Actually, right now she's in need of that. That's a huge issue. I also want to talk to her more about maybe getting some physical therapy in because she does have some issues with mobility.
Okay. Well, please encourage her if she's interested to make an appointment with me. I'd be happy to see her. Sounds like some of her problems are as bad or worse than certainly her husband's.
And they do have Medicare, but they don't have a supplement, they told me, so they're very concerned about the cost of seeking treatment. So just keep in mind that that's a barrier for them.
Certainly. What about the home environment? You mentioned a little bit about that, but can you expand on that maybe a little bit?
Yeah, so like I said, it's tidy, they keep it clean, but there are some hazards that they have issues with. So for example, they have uneven flooring, which makes it very difficult for someone who's recently had hip surgery to move around. They also have 4 cats that are always roaming around. So that's also posed an issue for her because, she's constantly having to navigate on not only the floor, but the cats. I had them walk around the house with me to discuss, what they saw as being hazards in the house. And they identified some of the similar things that I would have as well. We also talked about the fact that they didn't have any smoke detectors in the house, so I suggested that they needed to go to the local fire station so that they could get those for free.
That's a great resource, absolutely. Well, that's a lot of issues. And I'm going to ask you another question, though, just to kind of maybe expand a little bit about their eating habits and availability of food.
Yeah, so they do have limited access to fresh fruits and vegetables. That's a huge issue for them. Primarily, this all goes back to income. They, they're on a very, very limited income, so it's very hard for them to have access to, nutritious foods. So they're eating a lot of starches. They're eating a lot of beans, a lot of different things that aren't necessarily the best for their diet. They're also, they seem to have a lot of sweets around the house, a lot of bread. They did mention that their great-grandson that lives with them, he does receive meals at the school.
Oh, good.
So that's helpful to them. But I am concerned for him, you know, what he does when he's not at school and is eating with them. So,
Well, certainly with her being obese and you know, we're looking at some diabetic issues with him. You know, that's certainly an area of concern. I really appreciate all your help and information. It's been wonderful to identify some of these barriers that we can work on together to kind of come up jointly with the Thomases and try to come up with a plan that will work for everyone.
and I'm very committed to helping this family. I'm actually going to be in contact with KIPTA, our area agency on aging, and I'm going to talk to the community organizer about helping us set this up so that we can get them maybe a meal delivery program or something going, which would help them with the nutrition part. So I'll keep you in the loop about what's going on with them.
Great. I'd like to take some time to review that lab work that we had done when you were here before.
I take it wasn't very good.
No, you know, certainly there's always room for improvement. One of the tests we did was a long-term diabetes test. And for your age, we like for that number to be closer to 7.5, and yours was around 11. Which tells us there's some work to do.
Right.
We also stuck your finger, if you probably do remember that.
Yep.
And that test looks at what was really happening right then, that day. And that was about 280, which we like it quite a bit lower than that.
Yeah.
So it's kind of a little snapshot on what was going on that day. One of the other tests we did, we checked the function of your kidneys and found that to be really right where it needed to be, which is great because that helps us and gives us more options as far as what we can use for medication to look at treating your diabetes. So, you know, it was a little high, but I think there's some work we can do together.
Well, I'm starting to feel that I made a bad judgment probably in getting off the medication that I was given for my diabetes because I was not feeling all that awful, and so I just stopped taking it when I ran out of pills.
Right. Well, I don't want you to beat yourself up over that. You're here today, and that's what's important. You made the decision to come back, and so I think that shows that you really are having a commitment to wanting to make yourself feel better, take care of your health, and also look at some of the issues maybe that at your home and with your wife that maybe we can help you with. So it sounds like you're maybe at the point where we can discuss making some changes. Do you want to try to do that together?
Yeah, I'm game. I just think we're going in the right direction. This is very helpful.
And there's a lot that we do as far as diabetes treatment. And it can be a little overwhelming. So what I like to do is sort of ease my patients into the plan of care because there's several things that we need to look at. And I'll write some of this down for you because there will be quite a bit. But I'm going to ask Ms. Hughes to work on getting, and maybe you have some friends who have this, the little machine that tests your sugar, and get you the supplies to get you started on doing that.
Right.
We're going to look at just kind of, again, easing into it a couple times a day initially, and we'll show you how to write that down, and so that you can come back and see me, and we'll talk about that and work out a meal plan that will be doable for both you and your wife, and I know you have other folks in your household.
Right.
I think a grandson, and so I think
We have, yeah.
there's a lot to consider there.
Right.
The other thing we want to do is we do want to start you on a medication. The good news is it's once a day, and it's a low dose, and we have a lot of room to work with that. And like I said, your kidneys are working really well, so it's a good medication choice for you. Do you sound like this is something we could maybe commit to together? To
Yeah, I think, yeah. It sounds like all these things would be helpful right now.
Well, it's important to focus on one thing, and so we can be successful, and then we'll build on that, so as not to really, you know, overwhelm you with the changes that need to be made. And, you know, you can kind of celebrate each success as it goes along. So it's been several years since you've had an eye exam. I know, right. And so where they dilate your eyes and actually look in the back of your eyes. So I'd like to set that up. Would that be reasonable?
You know, my only problem with that is, again, my wife and I are on Medicare, and we don't have dental insurance, and we also The last time we went to the doctor, the eye doctor, my wife had to get some new glasses, and it was like $600. And right now, money's tight.
Absolutely. So there's a couple of things we can help you with that. I know Ms. Hughes had mentioned that she's going to help you with your application for Medicaid, which I would really strongly recommend we move forward with. That will help with payment of some of these different activities. And one thing, though, is it's important certainly to get you fitted for glasses if you need that, which Medicaid would help. But to look in the back of your eye is a medical type procedure, and that would be covered under your Medicare. And,
Oh, really?
and we want to screen you for changes relative to the diabetes that happen in the back of your eye. So that's really important that we move forward with that, because
Okay.
that's treatable.
Yeah, okay, I didn't know that was covered.
Yeah.
Okay.
So I know it seems like a lot, and I'm going to write, like I said, these things down. We're going to work with Missy, my assistant, and Miss Hughes
Okay.
to kind of sort of lay things out for you. And I'm really hoping that maybe you can come back in the next couple of weeks and we can review those numbers that you're going to write down for me,
Okay.
and kind of see, where you are and what we need to do.